Hi, this is For the Better, a podcast for healthcare marketing professionals navigating change and innovation. It's produced by Reason One, a digital agency dedicated to building a brighter digital future for the healthcare industry. I'm your host, Ben Cash.
Hello, and welcome to For the Better. I'm Lauren Miners, Director of Partnerships and Marketing for Reason One, and I'm joined today by Maureen Lee, who is the Digital Marketing Technology Manager at Emerson Health. Maureen and I met in person just this past spring, and she told a wonderful story about their website, but we're going to get into that. But what we really want to share today is kind of how her unique background really shaped how she and her team approached this project. So I don't usually read the bios, but all of this is important information to provide context to Maureen and her team and how everything shaped up. So, as I said, she is a digital marketing technology manager at Emerson Health, an independent community health system in northwestern suburbs of Boston, which serves 300,000 people in 25 towns. In the integrated and interdisciplinary marketing department, she works on website initiatives, multi platform marketing, and analytics driven campaigns. Prior to Emerson, she obtained her BA/BS from Tufts University in art history and psychology, along which she worked extensively for nonprofits in art, culture, sustainability, international relations, and healthcare. Some of her proudest moments involve connecting local, independent artists with government and private sector public art opportunities, placing artworks in the collections at Google and MIT, for example. That is so cool, sidebar. And then outside of work, she spends her time exploring the greater Boston area, lovely, reading American history, researching health policy, and mentoring local high school students. So, welcome, Maureen. I'm so happy to have you today.
Thank you so much, Lauren. I'm super excited for our chat.
Yes. So I'm going to start before the beginning of the web project, which is kind of like our hinge today. So, can you tell me just a little bit more about your art background and how you went from being an art history major and found yourself in a healthcare marketing department?
So, back to the very beginning, I was an art history major all along in college, and I really wanted to be a curator at a museum, and that's what I've been working towards all along. I wanted to get a PhD in art history, eventually become a museum curator, but somewhere along that journey, I felt like something was missing. And after reflecting upon it, I think it was the impact piece of it, like seeing real world impact of my work. Because I have, by that point, when I wanted to pivot, intern and worked extensively for a bunch of different art organizations and museums. And what I found out is that um, people in art history tend to be more pigeonholed into, the academia piece of it and not necessarily kind of seeing the real world impact of their work. Like, how do we make people, how do we promote our work so that more people know about, this exhibition that's going on at so and so museum? How do we make sure that, the education piece of it is also in it so that people feel that they belong in a museum? So, feeling like I wanted more out of just art history or beyond art history, I started looking elsewhere, and I stumbled upon this marketing class my senior year in college at Tufts University. I had this wonderful professor, Professor Jack Derby, who championed us being marketers of ourselves, of our professional identity. And so I was doing some soul searching, and he has this like famous quote of like, "What's your personal value proposition?" So I thought through what, as an art historian, I was bringing to the table. I think I have a lot of transferable skills in terms of, my psychology background, a good understanding of, human nature and how people perceive things, and how people process information, and more so as an art historian, how do we tell better stories so
Mhm.
that people can resonate? And so I thought maybe I want to try a bit more, try to pivot into marketing. And so that's how I started. And then from there, um, I was engaged in a lot of different projects for local nonprofits, in sustainability, um, in design, um, and eventually healthcare. Because I felt like healthcare has a lot of impact. Like everyone needs care, whether you're healthy or, suffering through a disease. And it's something that everyone has to encounter at every stage of life. So I thought, okay, why not start my professional career here and see where that takes me? So that's a long-winded way of saying, transferable skills, wanting to pivot, wanting more real-world impact, and that's how I ended up at Emerson.
That's so cool that you're so right about the transferable skill of, as you were talking about how do you educate people about art. um, I was thinking about, I recently went to the Salvador Dali Museum in St. Petersburg, and it's gorgeous, it's beautiful, and I get a lot out of being in there by myself, but having a docent come up and just like, hey, did you notice this, did you whatever, now I'll never forget that piece of art because someone came and told me a story about it. And in art and in healthcare, there can be a little bit of like friction there of, do I belong in this space? Is this for me? You know, especially if you're dealing with somebody who might have like a stigmatized condition or something, that just like it creates that sort of psychological barrier. And so it's up to both art historians, people in that space, and healthcare marketers to break that down, bring people in, tell those stories, and make them feel welcome so they can come and get that care. That's a really fascinating little parallel there.
Yeah, totally. And I love that, you just gave this anecdotal example from, I guess, the other side of the table, because, being an art history major, like there's so many things that I just take for granted. Like I've always felt like I belong in art spaces, whether it's a gallery or a museum or even, a theater. Versus like in healthcare, that's not necessarily the case because one, I wasn't born and raised here. I came here for college, and I've sort of had to navigate the healthcare system in the US from scratch without, say, like parental guidance, or, like even my peers were too young to give me advice on how to find a doctor, how to,
Oh,
like put together this team of, say, PCP and specialists and, other types of experts to help nurture and maintain my health. So that's something I've had to figure out all by myself. So I've had this kind of perspective from both sides, and now I see why it's so important that us as, healthcare, myself as a healthcare marketer, to make information more accessible, not talk in all the medical jargons, and not talk in all the insurance jargons, so that anyone coming from any place, whether they just move from, say, another part of the country to, say, like Eastern Massachusetts and are trying to seek help, or, they didn't grow up here, or they were afraid of getting care, the first half of their life and now decide to get care. Anyone in any point in their life or coming from any place, they should feel like they belong in healthcare and they should know how to navigate.
oh my God. Times 1,000. I am a huge proponent of access to healthcare and especially accessibility. And I just a high five on all of those points. So to like shift just a little bit, we're talking about healthcare now. So you had this professor that asked you a very prescient question. You shifted your direction and found yourself to Emerson. And what I understand about the project is it was like already sort of had a life of its own when you arrived, and kind of handed to you, right? Like, hey, first job out of college, well, let's rebuild a website. Easy peasy, right? So can you can you give us a sense of like, what did that feel like? What were you up against? Like, how did that all manifest? And because if it were me, my eyes would be dinner plates, and I would be like, what did I just get myself into?
Yeah, so that's such a great question. I look back, and I'm still in disbelief that, I was trusted with a project of this scale, being, newly out of college. I mean, obviously, I bring a lot of transferable skills from both a marketing standpoint, but also when it comes to the website. I've actually taken two computer science classes in college, so I kind of have a little bit of basic understanding to know how things integrate. But from like an experience in the real world, real like working world point of view, I didn't bring a lot. And so I feel super grateful that my team, my manager, they were able to trust me with this process and bring me along. And then obviously our partner, you guys at Reason One, it was a really fruitful collaboration. I feel like every step of the way, both ends, we like, both us as Emerson and Reason One, we were learning a lot about each other, but also just, the technical components, design, user experience, and we learned more about our health system, our patient demographic, um, by having to dig into the data to inform our decisions. So I guess going back to your question about, my feelings and what I felt like, I was facing. Um, One, I think I didn't really realize the scale and the weight of the project. Like first job out of college, also first time in the healthcare world, I was really excited. Like I was really excited. I was given this job opportunity, this opportunity to learn. So I approached it with a lot of curiosity. And that's something I think helped me even back in college when I was trying to pivot from a purely art and academic background into marketing. I guess going back to the story of that marketing class a little bit, I actually took it for the first time my senior year, first semester. And I was so scared because we were invited to do a lot of public speaking and give this like value proposition of ourselves, and actually dropped that class like the second week of the semester. And I was like calling my mom almost every day, talking about that class, saying I was so scared to put myself out there. And she just gave me this one piece of advice, which is to stay curious, see what happens, see what comes out of it. And so I took that class again as a challenge to myself my second semester of senior year. And that eventually led me here. And so going back to that curiosity piece, I think I was really excited about like what this all is because I didn't have a good enough idea of like, the general kind of timeline, and also like what are the different components of it from the get-go. And so it was more like I was being slowly initiated into this project, which really helped because it's like bite-sizing it, and then, like each week or each month I was working on something specific. It was like every day I had a to-do list instead of thinking, okay, we're gonna launch this project in like 12 months. Like if I had thought in that mindset, then I would have failed. So
That's I want to hook into a couple of things there because as you were talking, I was thinking of that phrase that we've all heard. It's like, how do you eat an elephant? One bite at a time, right? And yeah, if you were staring at an elephant and trying to think, how in the world am I going to eat all of this? Hugely overwhelming. But if pieces of elephant are coming out from, the kitchen in a normal cadence, then you're not thinking about the scale of it. Also, just want to say I'm not saying anybody should be eating elephants. That is not, we don't believe in that at Reason One. Just metaphorically speaking only. And then also the fact that you didn't know what you didn't know like really served you, because I'm sure there are probably marketers listening to this that have been through a few web redesign projects, and they're tough, they're long, they're a slog, and um, you come to I think later in your career you come to them with some baggage, and you didn't have that baggage, so you had the opportunity to just be curious and dive in. Like, what a freaking gift. Like, that's awesome. And just so it's reminding me to, when I'm up against a big project or something, like, just maintain that curiosity rather than comparing it to other experiences I might have had or seen other people go through. So, like, beginner's mindset, it really did serve you well. So,
100%. Yeah. And, speaking of animal analogies, there's this Chinese proverb that goes, um, a newly born calf isn't afraid of the tiger, which, cows are, but because they're newly born, like they don't have kind of a good sense of the world and the dangers in it. And so they feel really brave and like they're able to like go out and explore the world, and that's how I felt looking back when I approached this project.
oh, I love that. And I'm going to take a quick break to just notice that we both have art in our backgrounds. Your art is probably your art, correct?
Most of it,
Yes,
yes.
yes. What you can't see on this side of my screen is I have a giant fan that has a tiger on it. And so now I'm going to think about this proverb when I look at my tiger and not be afraid of that. Um, okay, back into it. So when I heard you speak at Neshco back in May, you mentioned during that it became an opportunity to really redefine, not just your work within Emerson, but also redefine the marketing function as a whole, which, as a career in-house marketer, is a really exciting concept to me because um, we know what we're up against. It can be reactive. It can be, there's a fair amount of burnout. And so I was really excited to hear that from you. So can you tell me a little bit more about how you were able to achieve that?
So I love that question because, it again, it's like in the beginning, we didn't realize what opportunity this website rebuild or new launch brought. And so it was sort of a discovery process for ourselves as well. Like we're a small team serving a pretty sizable, um, you know, community health system. And so like we have so many internal stakeholders that we're supporting, and then obviously the end goal is to support all our patients and the community. And so, we were really doing a lot and wanting to, maintain all of those like day-to-day tasks while also, trying to pull off this website build, obviously with the support of Reason One as a wonderful partner. But again, it was a lot of work, and we quickly realized that there was a bandwidth issue for something of this size. And so I guess it was somewhat out of necessity that we had to think through our priorities. Like, obviously the website rebuild was a huge priority because, the old website was like several years old, and it was built more with a kind of like trying to educate patients, but more from like a medical point of view standpoint. And so some of the content and the information structure um, wasn't necessarily patient friendly. And so we like, this new website was long overdue. And so we wanted to prioritize that. But it's like now that's part of our work, especially part of my work. And, my manager, Jackie, our chief marketing officer's everyday work. How do we maintain that, but also at the same time still work on the other things? So it's like, you know, looking at all the things that we're doing currently and seeing what are things that we can either automate or delegate out, or what are things that can wait a little bit. like kind of seeing things, taking a step back and seeing things from the big picture.
Yeah.
And so the overall kind of like wanting to redefine marketing's role within the organization kind of naturally came out of that need to prioritize aggressively.
Yeah, that's such a good point that I feel like, I mean, other in-house marketers will be like, yes, we all have a small team. The resources are always limited. The needs are always great, and prioritization is probably like the number one skill set to have in this world. But the fact that you didn't have a choice. You had to like really hone in and make this um, make it work because it had to happen. Um, Amazing.
Yeah. And I think, it takes a lot of kind of like deep understanding of ourselves as marketers because I'm sure you might resonate. I think all of us as marketers were creatives. Like we're coming up with all of the best ideas in the world, like every day or like every week in our team meetings. It was just like, everyone's like just like spitting out great ideas. But then it's like, how do we find the time and resources to execute on all of these properly and do a great job? And so it's like, obviously all of these ideas are wonderful, but like, so in my team, for example, one of our coworkers, Bridget, came up with this concept of an idea parking lot. That's where ideas go to park overnight, over a week, or over a year, or like for years. And so it's like, we have all these things that are going on that we know are important. How do we try to, find time and resources to add ideas from the parking lot into our everyday work?
Oh yeah, I definitely have an idea parking lot. I don't call it that, but yes, it's hard because you're right. When you're working with a lot of creative people, it's just this energy that just gets going in the room. Like imagine almost like a writer's room or something like that. And then also you have external stakeholders that have great ideas and have big thoughts and all of that. And like there's this sense of balance of I have to serve the strategy and I also have to serve the stakeholders. So, can you kind of talk a little bit more about how you created a system of collaboration with all of these other folks who have, valid interest and want to be involved in the process of developing something this large?
Yeah, so I'd say 2 points. One, we shifted, under the guidance of Jackie, we shifted from this mindset of like more permission driven or instruction driven to more like evidence driven and kind of an FYI approval approach. So I'll expand on that a little bit later. And then the second point is just trying to identify alignment between, internal stakeholders and ourselves and our patients. And so, how we've operated, and I think a lot of healthcare marketers operate in the past or still, is that, there are the patients as one bucket, and then there are the internal stakeholders. And then, within the internal stakeholders, there are actually several different groups. There's the practice managers, there's, upper management, and then there's day-to-day frontline staff, and then on the side there's also folks like us who are the supporting departments like development or philanthropy, and then ITIS, and then us marketing. And so it's like there's so many different needs, and then on the side there's us who are being really creative, and we're given like one ask, and then all of a sudden we have like 18 different ideas. So like there are all of these different things and purposes that need to be aligned. And then I think eventually there is alignment if we, think through it deeply enough. Because at the end of the day, like, every day we do as marketing per se, we do interface mostly with our internal stakeholders. But at the end of the day, our internal stakeholders are serving the patients, our patient community. And so at the end of the day, we as marketing, we are serving the patients. And, how do we put ourselves in the patient's shoes? It's not by thinking about the patient population as like a whole, this like really ambiguous idea of, like the age groups and, brackets of like, zip codes that we see from the data, but it's like, first of all, we are also healthcare patients ourselves, and the patients, they are individuals. They're individuals, families with unique needs, and so it's just thinking about what an individual will, how they will go about their day, how they will go about making their healthcare decisions, how will they access healthcare information. Like that is our end goal. Like that's who we are serving. So going back to my initial point, again, it is thinking through how we can serve patients as the target audience, as the end goal. So, you know, internal stakeholders, they may sometimes have a lot of ideas about what marketing should do for them, how we should support them. They may come in with kind of a mindset of like, okay, I need a flyer, I need a QR code, or I need this updated on the website. So, what we discovered works really well in our role as marketing is, how do we dig deeper, double click on that ask, which is more so usually like marketing tactics and not necessarily a marketing strategy. So it's like they have an ask, for example, to me, they say, "Oh, Maureen, I want this information represented on the website." So then I'll go back and ask them, why would you want it on the website? Like, who are you trying to promote to? Like, what's the purpose of this information? Does it actually serve the patients? And then say I put it on the website, what have you thought through the distribution channel? Like, do you already have an idea? Or I can brainstorm with you. I can work with you on, working from that end goal. And so it's the idea of like being more of a thought partner or a strategic partner to internal stakeholders, thinking through how we can serve patients eventually, and not necessarily just, like answering the asks. And so one specific example of how we approach content for the new website, which it was a lot of work because, there's the kind of transferring information from the old website, but also it's like, looking at that information, like, does that serve the patients? And so our specific approach ended up being we would write the content or rewrite the content from the patient's point of view, and then, have that draft go to the internal stakeholders, many times the practice managers or the providers, and say, can you review this information for me? Mostly for one, information accuracy, especially from a medical point of view, because again, we're marketers. Like I never took any biology class in college. I took several biology classes back in high school, but that was so many years ago.
Yeah.
And I'm sure marketers also resonate. And two, other than checking for information accuracy, it is also reminding them of the purpose of this content. And so asking, is this information that your frontline staff get asked a lot? Like what are the questions that, front desk staff gets asked a lot, and also, what are the questions that patients ask in the exam room? So it's, just kind of, again, like wrapping everything around the patient and being more approval based. Like this is so much more streamlined than kind of instruction based, because if we were to go to the each practice, each service line and ask them, hey, we're building a new website, what do you want on your page? And then, they are so busy, they're frontline staff, so they'll take like, several weeks to get some information pulled together for us. And then um, that information inevitably is going to be from the point of view of a provider and might have some medical jargon that we as healthcare marketers might not even understand. And so then that became becomes the kind of a negotiation process of like, does this needs to be does this need to be on the website? Does this need to be represented? Does the patient understand this? So, streamlining it with the patient in mind.
Yeah, I love that so much because like you're being empathetic to two audiences at once. You're being empathetic to your front line, to your, your SMEs. They don't have time. It's so much easier for them to review and mark up something than it is to like make them produce something. You're being more empathetic to your patient population by providing them the information that they are actually asking. And then here's the other thing is that like as we're moving more to an AEO, GEO over SEO, having that content that is like question based, like the robots love that. So like you are setting yourself up for success by having this mindset. You're serving the humans first, as we should, and then also taking advantage of the way that the technology is moving for your own reach and stuff. So like brava, that's like that is the approach. That is the approach.
Totally. Yeah, and I love that you brought up the point of the shift of, how this content is being accessed or how patients are finding our content. And so nowadays it's more like AI optimization rather than in the old days being SEO. And that's one thing that we found we really benefited from the new website launch, which is providers now have this mindset of like, what are the things that marketing can help produce for us that is going to be eventually beneficial for both the patients and also our own job as frontline staff. So, one recent example is uh, our urgent care team came to us and they basically proposed the idea that they get asked these questions a lot about how to access urgent care or even like where to park at our urgent care location. And so they took some initiative, came up with content for what to expect for the patients. And we helped them craft that content, edit that, and then put it on the website and made sure it's in a couple different places as well so that patients come in with the peace of mind knowing exactly what to expect, and that helps both patients and also the medical providers.
Oh yeah, totally. Because medical campus, I've never been on a medical campus that made any sense. Like it's always a maze because that's just how they get developed over time, right? Like it's just kind of part of it. Um, and that's so forward thinking of you. Like, I just want to plant a flag that innovation does not have to mean new sparkly stuff. It can simply just be making sure that people have what they need, where they expect to find it. And providing that kind of very simple, basic, foundational information like what door do I use? What parking decks am I supposed to go to? Um, Makes people feel cared for before they even receive their care. So like you're really thinking out front, and I think that kind of goes back to your background of curiosity because you didn't come with all of this like preconceived notion and baggage, so to speak.
Yeah, yeah. And then again, I think it's really, props to my team as well, because I was talking earlier about how one, we are informed by who we are because we're, professionally we are marketers within healthcare, but in daily life my team, for example, we're a team of all wonderful women of different age and like different backgrounds and different kind of like family structures. So and also obviously each individually we have navigated different health conditions. So it's like, how do we come together, bringing our strengths as each individual, the things that we've thought through as, me as a single person navigating the system, a lot of my coworkers as moms of cute kids of different ages. How do we bring that knowledge from everyday lived experience into our work, which has really helped inform how we work?
Oh, that's amazing. And I can't wait to see like how this, because you just launched not terribly long ago, right? It was earlier this
About
year.
half a year ago.
Yeah,
Yeah.
yeah. So, as we know, these are living, breathing things, and I'm excited to see what's next, especially coming from you and your team that has this kind of mindset. I would love to check in a year and just see like how this has evolved for all of you. So,
Totally.
well, thank you so much again for hanging out with me this afternoon. I hope this has been as fun for you as it has for me. I've learned a lot. I feel seen as a marketer. Very much feeling seen right now, and can't wait to see you again in person sometime very soon, I hope.
Hopefully. Yeah.
Amazing.
Well, thank you so much, Lauren. I really enjoyed our conversation. And again, thank you for asking such great questions.
Well, thank you for all of your lovely answers. Talk soon.